Got a case for you.
Smells funny.
Patient had an idiopathic anaphylactic reaction. Stumped 2 ER docs and an immunologist from Johns Hopkins.
Patient went from asymptomatic to fried kidneys in less than a year. Stumped 3 internists and a department chair from Harvard.
14-year-old girl, intermittent attacks.
4-year-old boy, consistently at death's door.
This patient died 5 years ago.
I didn't say which side of the door he was on. The fact that he's dead makes it more interesting. 4-year-olds do not die of burgers.
I thought it was relevant.
Death is a consequence, not a symptom. And if it's not a symptom, it's not relevant.
Shouldn't we be trying to maximize what we can save here? 14-year-old, your freedom, our asses.
Right. Save your asses.
She was in a car accident when she was 2. She only had minor injuries, but her father died.
That was 12 years ago. You think that's pertinent?
No, I think it's sad. She got sick in the middle of her 14th birthday party. Which is sad and pertinent. Maybe she was opening a present that triggered the reaction.
Whose house?
Pissing contest with Foreman.
Last thing she ate was strawberry cake, but allergy tests for everything were negative.
You like your dentist? I'm still going to my pediatric one. What's your dentist's name?
Williams.
What if it's not an allergic reaction? Hereditary angioedema or systemic mastocytosis could mimic anaphylaxis.
You're not sure of his name? You just saw him this morning.
The assistant's name is Angie. Her home number is...
Normal complement studies, no skin lesions.
You had a manicure. This is fresh. You weren't at the dentist. Why would you lie about that?
To avoid having this conversation.
Elevated BP. What about pheochromocytoma?
Or an anaphylactoid reaction which could be triggered by certain opioids.
You've had your hair cut 3 times since I've met you. You can't be embarrassed about a manicure. There's gotta be a deeper reason.
Did the house give you homework?
She's not on any meds.
Haven't you heard? Everybody lies.
And the tox screen was clean.
Feel free to jump in at any time.
We'll check catecholamines for pheo and run an expanded opioid panel. You see what the patient says about drug use when her mother's out of the room.
What kind of drugs?
What kind did you have in mind?
Iris has always been a moody girl, and now that she's a teenager, it's gotten worse. So for the past few months, I've been giving something to relax her. Diazepam. I tell her it's vitamin C. Being normal is very important to Iris. She couldn't handle the thought of being on meds.
Anti-anxiety medications would explain it. If we keep her off, she'll be moody, but healthy. Or it's something else.
Feeling any pain or cramping here? A bit. But not just there, here.
Breast tenderness. Have you been having regular periods, Iris?
Not really.
What is it?
I think we should run a pregnancy test.
Iris isn't sexually active. She doesn't even have a boyfriend.
Pregnancy would explain all of her symptoms, can even cause some unpredictable allergic reactions.
How can I be pregnant if I've never even had sex?
We just need a drop of blood.
What's the matter?
My arms. I can't feel my arms.
Everything looks good.
What's the matter? My arms.
Still nothing?
Oh, now they're sore.
Paresthesia's gone.
The bruising be caused by physical trauma?
You think she fell out of bed repeatedly?
A blood disorder, maybe thrombocytopenia.
A vitamin K deficiency or scurvy could explain bleeding problems, and pregnancy could exacerbate it.
Boys do a home search, girls do lab tests. Pretty sure that's not sexist.
She does have a boyfriend.
Love letters. Porn.
Nasty kind. Torture, rape, animals.
Sweet kid.
He came here last night. And he told me I should leave. But I didn't want to, and he got mad.
He hit you?
Physical trauma.
Explains the negatives of the blood disorder.
We should call the police.
I won't tell them anything.
That's ridiculous. He beat you.
What is it?
It's getting hard to see. What the hell is happening to me?
There are two types of people. Those who can move on and those who can't. My father keeps up a good front, but he's just like Emery. You need to leave him alone.
So he has two types of people inside of him. MRA was normal.
Yeah, how did
I
you...
found out where your boyfriend lives. When I paid him a visit, he took off, right in front of a car.
You're lying.
He's down in the ER right now.
Shut up, you lying sack of crap.
Iris.
How do you know I'm lying? How do you know your boyfriend's okay?
'Cause I'm right here, you dick.
When you say your boyfriend hit you, it means you actually hit yourself.
And the pregnancy doesn't take a boyfriend, just a boy. You may not be aware of half the things you've done.
How could this be happening to my own daughter without me knowing it?
Diazepam was masking it. Taking her off made it more apparent.
But I wasn't on diazepam. What is that?
That's what those vitamin pills were. Iris, I am so sorry. I thought you were moody, and I didn't want you to think you needed medication. Oh my God, I can't believe how stupid I've been.
We need you to help us with something. Different alters can have different apparent symptoms. Allergies, paresthesia, vision loss, changes in blood pressure.
Do you think I'm making this up?
Your symptoms are real, but some are physiological and others are psychological.
So there's something wrong with her, in addition to the multiple personalities?
Yes, but we won't know what until we access her alters and compare their symptoms.
Well, how do you do that?
Hypnosis. You remember being hurt?
I remember everything.
Baby. It's going to be okay.
Why didn't you ever tell me?
It was my fault that he died.
Oh no.
So what? I was crying and he couldn't drive. It was my fault, Daddy.
Oh no. No, honey. You were just a baby. It wasn't your fault. No, shh.
It's my fault. I'm sorry, Mommy. I'm so sorry.
I'm not seeing an embryo in the fallopian tube.
I'm not seeing an embryo anyway.
Which idiot did the pregnancy test?
I did one of them, Chase did another, Taub did a third. 3 tests, 3 positives. What happened to your eye?
I grabbed Park's ass. Exoplanets.
I think he said exoplanets.
Wait for it.
We can't actually see them. We infer their existence because of the effect they have on the star they orbit.
Pregnancy test only infers an embryo's existence because of elevated HCG levels.
Which could also be caused by choriocarcinoma, which affects the placenta, mimics pregnancy, and causes elevated BP and vaginal bleeding.
Occult choriocarcinoma, which is why we didn't see it on the ultrasound.
Tell all the alters that they have cancer.